Good afternoon, everybody. I'm proud to welcome into the briefing room General David Rodriguez, Commander of Africa Command. He's here to give you an update on U.S. contributions to the effort against Ebola, U.S. military contributions to the effort against Ebola in West Africa. And with that, sir, I'll turn it over to you.
All right, thank you.
By the way, I'll moderate, and so I'll be choosing you. We got 30 minutes total for this.
Okay, well, good morning. Good to see you all again. I'm glad to have the opportunity to talk to you about how U.S. Africa Command is supporting the comprehensive U.S. government effort to help contain the outbreak of Ebola in West Africa. As you know, the President considers containing the spread of Ebola to be a national security priority that requires mobilizing our collective resources to enable the success of the international effort. Recently, I discussed the progress of the response with the President, who underscored the pivotal role of American leadership in containing the epidemic at its source. In support of the U.S. government effort, the military focus is on providing logistics, training, and engineering support in conjunction with the greater interagency effort. We stood up the headquarters, Joint Force Command, United Assistance in Monrovia, Liberia, to provide regional coordination of U.S. military support to the U.S. and international relief efforts. Finally, we placed 2 additional mobile medical labs into operation last week, significantly increasing the capacity for rapidly diagnosing Ebola. We are also establishing a facility capable of training healthcare support workers, enabling healthcare workers to safely provide direct medical care to patients. Now, this is very important, and I want you to help us to tell our families and the American public the health and safety of the team supporting this mission is our priority. Let me assure you, by providing pre-deployment training, adhering to strict medical protocols while deployed, and carrying out carefully planned reintegration measures based on risk and exposure, I am confident that we can ensure our service members' safety and the safety of their families and the American people. As we deploy America's sons and daughters to support this comprehensive effort, we will do everything in our power to address and mitigate the potential risk to our service members, civilian employees, contractors, and their families. Preventing the spread of Ebola is the core task of this effort. This is a key requirement in everything that we do in this operation, and this applies both to our support efforts and the protection of our own people. The professionals of Doctors Without Borders have a remarkable record of safe operation in their fight against the spread of Ebola. We have looked at their procedures and consulted with the U.S. Agency for International Development, the Centers for Disease Control, the World Health Organization, and others to develop our protocols based on known risks and prudent planning. We are taking the following steps to ensure the safety of our people. We are implementing procedures to reduce or eliminate the risk of transmission to service members as they go about their daily missions while deployed, including the use of personal protective equipment, hygiene protocols, and constant monitoring. So again, let me assure you, by providing the pre-deployment training, adhering to strict medical protocols while deployed, and carrying out carefully planned reintegration measures based on risk and exposure, I am confident that we can ensure our service members' safety and the safety of the American people. In the end, our equipment, training, procedures, and most of all, the discipline of our leaders and our force will help us to ensure that our team accomplishes the mission without putting our nation and fellow citizens at risk. And as I said before, stopping the spread of this disease is the core mission here. We're all focused. We are focused in all of our efforts to accomplish this, both by supporting the international effort and by keeping our own people as safe as we can. And with that, I'll take your questions. Thank you.
Okay, we'll do it. I'll moderate. Please identify who you are and who you're with when we ask the question. Start with Lita.
General Lolita Baldor with AP. There's been some questions about whether the response to the overall crisis has been too slow. Do the troops that you have now, are they enough to get the job done, do you think? Or do you think in order to move things along more rapidly and construct some of the facilities more quickly, do you think you're going to need more troops there? And secondly, do you have a cost estimate yet on the military response?
Well, first of all, one of the challenges, as you can imagine here, is continuing to gain and grow situational understanding over time because of some of the isolated places that is creating problems. So we're supporting the USAID efforts to do that. And right now, the leadership has approved up to almost 4,000 people, as Admiral Kirby talked to you about. And we have a lot of flexibility to put people in there as they're needed and who's needed. So I think right now we have the sufficient capacity and numbers to do that. The speed at which these things are done is it's not just one challenge with doing that. Part of it is the ability of the host nation to absorb it. As you can imagine, their infrastructure and their capacity to house people, to feed people, and all that is limited. So it's all going to have to come in a very, very carefully orchestrated, based on the demand out at the front. At the same time, they're increasing their situational understanding over time. So just as an example of that, these mobile labs are very, very important because, as you can imagine, some people have malaria, some people have the flu, and it's really important to find out who you have to treat and who you don't. So we've already flowed 2 more of those in that are already having a major impact, and we have several more on the way to better adjust it. But again, that wasn't what we expected when we got the first mission. So I think we have the right flexibility and ability to adjust as needed, ma'am.
Cost?
The cost estimates right now are probably around $750 million for our efforts, and that's in about a 6-month period. And again, the challenge with doing that is that those labs, for example, were not in the current, in the initial plan. So it's going to have to be a free-flowing, flexible adjustment on all that, ma'am.
Jim Miklashevsky with NBC. General, will any U.S. military personnel be involved in the direct treatment of any Ebola patients, or in the training the healthcare givers? Will they be come into contact with any Ebola patients?
No, now the mobile labs are different, but no for the majority of the force. The mobile labs are testing people, okay, and some of them will have the Ebola virus. Now, those are trained at the highest level of something like nuclear, biological, and chemical. So they're all trained at a very, very high level. And they've been, the one from Walter Reed has been operating there for many years, for example, and the 2 that we just deployed meet those standards of training.
Do you have any numbers of those who will be involved in the lab operations, and what kind of protections, what kind of protocol will they observe? And if any U.S. military personnel should contract Ebola, what is the protocol there? What happens?
Yes. First, on the numbers in the labs, they're between a 3 and a 4 person team. We have 3 labs deployed right now. We will probably deploy several others. So it'll add, 1 lab adds 3 to 4 additional people. And again, those people are trained to the very highest level of operating in a nuclear, biological, chemical arena, and they get tested continually, and they're the ones who are testing all the people. They will be the primary ones that come in contact with anybody. On the second point, if somebody does contract Ebola and becomes symptomatic, they will be handled in just like you've seen on the recent ones who came back on an aircraft that was specially designed to bring them back, and they'll go back to one of the centers that is specially designed to handle the Ebola patients right now.
So they'll be returned to the U.S.?
Yes, they will. Yes.
Jennifer Griffin, Fox News. Sir, will U.S. Armed Forces personnel be working side by side with Liberian troops as they build these emergency treatment units? I thought we had been told that they would be separate from the Liberian forces. Is there a risk of contamination by working closely with the partner nations' troops? First question. And do you have enough of the personal protective equipment that you need, or is there a shortage of that? And have you stockpiled any of this ZMapp, the treatment that was given to the 2 missionaries that had been proven in case troops are exposed to the virus?
We have people that will be working with and observing the other people who are building the ETUs, whether it be the Armed Forces of Liberia or contractors, to ensure that they're meeting the standards and oversight. All the people who are doing that are tested and meet all the medical protocols to ensure that they do not have the disease. And then the continual daily checks are also a part of it. So all the people that we're working with go through those medical protocols. On the last point, on the virus, we do not have that stockpiled. And right now, that is, you'll have to get the expert opinion of the CDC, but that's still to be determined whether it's effective or not. And they have a date in the future when they may be able to tell whether it's effective or not. So we are not stockpiling that. And last, we have sufficient personal protective equipment for ourselves, and we will continue to make sure that that's the way throughout the process.
General Andrew Tillman with Military Times. Can you tell us a little bit about where these 3,000 or 4,000 service members will be housed, and can you give us a little bit more information about what kind of personal protective gear are we talking about, what kind of hygiene protocols are we talking about, and what kind of monitoring is going to be done on a daily basis?
Yes, for the majority of the people, they will be in places like the Minister of Defense or some of the military posts that are out there. Some will be over at the airfields and the locations where people will be flowing in personnel and equipment. We will have trainers that are in a training facility, and most of these places that are in and around Monrovia are actually in buildings. The people will either live in the Minister of Defense areas, or they will live in tent city type procedures where everything will be taken care of for them, to include their food and water and those things, because you have to watch all that obviously at these points. And then on the protocols that occur in a daily monitoring, mainly it's built around the multiple washings that you have to do with your hands and feet and everything else. I mean, when you go in one of these Ebola treatment units, you're going to wash your hands and feet multiple times. You're going to get your temperature taken in and out, and then there is a checklist of things to ask each personnel based on the virus or any other sickness, quite frankly, that could be coming up. Okay? It's just like a self-questionnaire and a checklist. The personal protective gear, the majority of the people will just deploy with personal protective gear that includes gloves and masks and things like that. They don't need the whole suit as such because they're not going to be in contact with any of the people.
Dave Martin with CBS. Understanding your point about the ability of Liberia to absorb all this stuff, you have the feeling that if say the American embassy were under attack in Liberia, it wouldn't take the 101st Airborne weeks to get there. So what is it about this operation that makes it seem to be unrolling in a much slower pace than sending U.S. troops to protect Americans, for instance?
There's the Protect the Americans piece is a small number. We already have about 5 times what we've sent in, for example, in Libya to protect the U.S. Embassy in that situation. And that infrastructure was there, as well as all the ability to sustain themselves. The other challenge out there in Liberia is, as you can imagine, their whole nation is overwhelmed. Their health facilities are overwhelmed. That's all broken down. So we have to bring in everything at the same time. And again, they right now the ETUs, for example, aren't even located all the locations where they want them. So those are some of the challenges that we're being faced with. That we just can't. We just don't want to overwhelm them and press things in there that they can't absorb at all. The airfield is the same way, for example. Okay.
Kate Brennan from Foreign Policy. Could you tell us how the decision was made to not have U.S. military medical personnel treat Ebola patients directly? And do you have any concerns about manning these Ebola treatment units on the ground? There's been calls from Doctors Without Borders that more people are needed, not necessarily more facilities, although both are needed. So if you could answer both of those, please.
I'm not so sure about how the decision was made, but the bottom line is that's the position right now of the leadership. It's the international community's role right now, and that's where everybody is encouraging people to come forward to do that, and that's where we stand until we move, to some future thing that they'll continue to relook the decision and continue to adapt to what's required on the ground. Again, we're filling in the demands that the international community needs us to do. That's for command and control. It's for engineering support. It's for logistics and those type of things, okay? So that's where we're focusing our effort, okay? And that's what they've asked us to.
Do you believe right now that there's a scenario that you can see that would push you past 3,900 or 4,000? And on the question of security there, do you think the concerns in Congress about